Welcome to Quick Medical Review. In this episode, we're going to discuss Raynaud's phenomenon. So, what is Raynaud's phenomenon? It's a condition characterized by episodes of reduced blood flow to the fingers and toes, causing dramatic color changes, white from pallor, blue from deoxygenation, and red with reperfusion. These episodes are often triggered by cold exposure or emotional stress and can be uncomfortable, even painful for those affected. There are two main types of Raynaud's phenomenon. Primary Raynaud's is the more common type and occurs on its own without any underlying disease. It's usually benign and doesn't cause long-term damage. On the other hand, secondary Raynaud's is associated with underlying conditions like systemic sclerosis, lupus, or atherosclerosis. This form is often more severe and can lead to complications like ulcers or, in rare cases, tissue necrosis. So, what's happening physiologically? The episodes are due to vasospasm, where the small blood vessels in the extremities constrict excessively in response to triggers like cold or stress. In secondary Raynaud's, the problem is often compounded by structural changes in the blood vessels, making the condition more difficult to manage. Clinically, patients will report color changes in their fingers or toes, often in a triphasic pattern: white, blue, then red. Symptoms may include numbness, tingling, or pain. Severe cases, particularly in secondary Raynaud's phenomenon, can lead to complications like digital ulcers or gangrene. Diagnosing Raynaud's is mostly clinical. A good history is key, focusing on the characteristic color changes and triggers. For secondary Raynaud's, additional tests like antinuclear antibodies or nail fold capillaroscopy might help identify underlying connective tissue diseases. Treatment depends on the severity of the condition. For most patients, lifestyle modifications are the first step. These include avoiding cold exposure, wearing warm gloves or socks, and quitting smoking, as smoking worsens vascular constriction. For more severe cases, medications like calcium channel blockers, such as nifedipine, can be prescribed to help relax the blood vessels. If these don't work, other treatments like phosphodiesterase 5 inhibitors or prostacyclins might be considered. In extreme cases where there is a risk of tissue loss, surgical options like sympathectomy may be needed. While primary Raynaud's is generally harmless, secondary Raynaud's can lead to serious complications if left untreated. The key is early recognition and appropriate management, particularly in cases where an underlying condition is present. With the right interventions, patients can lead comfortable and largely symptom-free lives. And that wraps up today's episode of Quick Medical Review. If you found this helpful, share it with your colleagues or friends, and don't forget to subscribe for more quick and insightful medical updates. Until next time, stay informed and keep learning.